The following portion of Daytime Tri-Cities is sponsored by HMG. Well, as we move into a new year, a lot of us think about our goals. A new focus may be on health and wellness. We know how important that is, especially self-care. And I know you're probably thinking, great, add that to my to-do list. Well, this morning we talked with Dr. Emily Campbell, Holston Medical Group Primary Care and Sports Medicine physician, to get her perspective on self-care in the new year.
Through these pandemic and post-pandemic year here, one thing that we've all kind of experienced is like this just collective exhaustion. We're just so tired.
Dr. Emily Campbell says taking care of yourself needs to be a priority.
We need to step back and just reframe and say, wait a minute, how do I spend my time during my day? How do I spend my time during my week? Are there things that I'm doing and spending my time on that are not what I want to prioritize, that are not what are feeding into my mental well-being? And that's really where we need to make the start to consider our self-care.
Dr. Campbell says oftentimes that means reevaluating, looking at things like relationships or habits that may not be in our best interest.
So we're just moving away from things that really don't feed into our overall wellness and moving towards things that actually provide us a little bit more space.
Space that gives us energy. She says if we're always going and giving, we can be left feeling depleted. And she says, remember, mental health is health. They are directly related.
People who have struggled with mental health issues absolutely have increased risk of cardiovascular disease and diabetes and pulmonary conditions and GI disorders. And that's just from the mental health aspect. So all those things are increased as far as your physical health, as far as risk for those things if we don't have sound mental health. So everything is connected.
Dr. Campbell says there are online health questionnaires that can help you determine the intensity of your symptoms. She also encourages everyone to talk with their primary care provider.
We all have our ups and down days, absolutely. That's just being human, but when it starts to bleed into, 1 week after another, so if you're about 2 weeks in and you've had no break from these anxious, overwhelming, depressive symptoms, that's really a time where you need to seek some help through your physician, healthcare professional.
Now, to learn more or to access that questionnaire that she was talking about online, you can check out the Health Matters blog. You can do that by visiting holstonmedicalgroup.com. The preceding portion of Daytime Tri-Cities was sponsored by HMG.